Right, it's a lovely Tuesday morning in Abuja. Hope it is the same wherever you are watching us from. And welcome to Vanessa 10 on NTA News 24. I am Musbao and Wahab.
And I am Norlin Ebel Ame. We thank you very much for joining us. We now begin with the headlines.
Nigeria responds to COVID-19 scourge with interministerial and multi-sectoral reassessment.
To assure Nigerians that the Federal Ministry of Health has been strengthening measures to ensure that an outbreak in Nigeria is controlled and contained.
Aviation Minister takes a tough stand on VIPs resisting screening at airports.
Vice President chairs inaugural meeting of a review panel on small arms and light weapons.
And federal government expresses deep concern over persistent hike in the price of homegrown rice.
All right, thanks a lot for staying tuned in. We're starting with reports on various preventive measures against coronavirus. Now, the confirmation of a first case of coronavirus disease, COVID-19, in Nigeria has led to the reconvening of the interministerial and multi-sectoral meeting on preparedness and response to the global scourge.
This followed the evaluation of issues revolving around Nigeria's efforts at protecting citizens from disease. Intensified flow of credible information on COVID-19 was emphasized. Health correspondent Rabi Abdallah has the report.
When the maiden meeting of the Interministerial and Multisectoral Preparedness and Response on COVID-19 was convened on the 31st of January this year, Nigeria was in a secured state from the disease. The agenda and focus of this follow-up meeting is therefore a more brainstorming one for obvious reason. Ministers of the line ministries and representatives of relevant agencies involved in the preparedness and response on the disease took turns to highlight efforts and challenges, with the Minister of Health, Dr. Osage Ehanire, driving the health component.
Opportunity to assure Nigerians that the Federal Ministry of Health has been strengthening measures to ensure that an outbreak in Nigeria is controlled and contained. A multi-sectoral corona preparedness group led by the Nigeria Center for Disease Control has been activated at its Emergency Operations Center, and we work closely with Lagos State health authorities to respond to this case and implement firm control measures.
The immediate national investment, which we really want this Honorable House to do or to address, the national stockpile of response commodities, the renovation and strengthening of treatment centers, digitalization of surveillance and contact tracing across the country. We are using SOMAS. We have started, but we still want to continue. Then for the states, investment in treatment centers.
For the port health, I think there's a need to see synchronization or harmonization of the information from those who enter the country vis-a-vis the data that is being collected by NCDC. How do we track these people?
What lies ahead is an action plan that identifies gaps where prevention, response and containment of COVID-19 is concerned. At a news conference that preceded the meeting, the health minister reiterated that there is no new case of COVID-19 apart from the index case on Lagos. In Abuja, Rabi Abdallah, NTA News.
Meanwhile, Information and Culture Minister Lai Mohammed has again assured that the information dissemination platforms under his ministry have the capacity to generate the desired awareness and enlightenment campaign to sensitize the populace about the ongoing campaign to ensure that Nigerians live well in the face of the current COVID-19 pandemic. Anthony Forson reports.
Making their submissions at the reconvened interministerial and multisectoral meeting for public health emergency preparedness and response to the novel coronavirus awareness and sensitization, the Director General of Nigerian Television Authority, his Radio Nigeria counterpart, as well as that of the National Orientation Agency, briefed the meeting and made some proposals.
So I want to use this opportunity to call on all the stakeholders present here to please give us through the Ministry of Information all the relevant information that needs to be given out to the public. We have the platforms, we have the units, we are ready, and once we have the contents, you can leave the rest to us, and we can assure you that the information will get to the right corners.
We try to do programs in order to make sure that people do not panic, because that is one of the most important things in this kind of situation. If you allow people to panic, then you have even much bigger problem in your hands.
Activate and populate all our social media outfits with this information, develop flyers in local languages on what to do, and craft the messages that will send out. Now we are seeking partnership with both the NTA and the Federal Radio Corporation to send out these messages already in Igbo, in Yoruba, in Hausa, in Fulfulde, and in Pidgin.
With this strategy as a way forward, Information and Culture Minister Lai Mohammed was quick to sue for caution from the states.
While we have control of our FRCM platform, we don't have control of the states' platforms, and the state platforms are probably much more important for this kind of advocacy than the federal government platform. So please, we appeal to all state governments, and this is not political. This is about Nigeria. Secondly, we've also resolved that we would want to be giving updates on all our news bulletins every hour on radio, television, and the news agency platform. But we need the content so we can get an hourly update. It doesn't need to be anything new, but some people did not hear it at 10 o'clock, might hear it at 11 o'clock.
In Abuja, Anthony Forson, NTA News.
Every passenger on arrival at the nation's international airports must submit to screening exercise instituted to check the importation of coronavirus and other infectious diseases into the country.
This is the stand of Aviation Minister Hadi Sirika at a multi-sectoral follow-up meeting on COVID-19 in Abuja after receiving complaints that some very important personalities and airlines are not complying with set guidelines. Emmanuel Anyimiro reports.
Some high-profile persons don't always want to fill the form on arrival. Why? Because they say the forms are given to them on the aircraft very late.
These are some constraints faced by Port Health Services in the bid to put the nation on the path of sound health at airports. The story that must change as federal government begins enforcement of total compliance.
So we do need to know who these VIPs are. No one can sack you because their action or inaction will sack all of us because it will kill us. So we'll sack them before they sack you. So it's important that we know this. You can quietly send the message to Honorable Minister, and I'm sure that will be reported to us, and we'll deal with that person.
Agencies in the aviation sector pledged their complementary roles in achieving zero importation of infectious diseases into the country.
Working in collaboration with Port Health Services and all other agencies in the airports to ensure that this disease does not have a foothold in the country.
Our review that if the crew members can pick this passenger on board that is developing symptoms, showing symptoms, the pilot in command notifies the air traffic control of destination aerodrome, and the air traffic control notifies the Port Health Services. By the time the plane touches down, the plane is parked in a separate place, and that is contained. It doesn't come into the terminal building. That is the plan that we have been practicing.
To show leadership by example, Hadi Sirika in 2018, during the Ebola scare, was caught on camera subjecting himself to screening on arrival at the Abuja airport. Emmanuel Ayemiro, NT News.
Musba, why do you think people resist the screening at the airport?
Well, actually, it's an uncalled for situation. I don't know why people should see this as a sort of derogatory activity, because we should know that these are critical moments across the world, not only in Nigeria, and you're coming from a particular country. Whatever they ask you to do in that country, you comply. But when you come to your own country, you want to prove the big man in you. And we should know that this virus does not respect any status. It does not respect whether you're a rich man or poor. So we should submit and do the necessary things to prevent the importation of this disease, I think.
Yes.
All right, let's move on to Lagos now, as passengers screening processes and healthcare strategies have been heightened at the Murtala Mohammed International Airport in Lagos, a development that has generated commendation from travelers on the proactiveness of the federal government. Michael Olaleye has the report.
The Italian with the first index case of coronavirus in Nigeria was actually one of the passengers who passed through this thermal imaging machine last week without the scanner raising any alarm. Now the measures at the Murtala Mohammed International Airport have been strengthened to address unforeseeable lapses as screening of passengers takes an average of 10 minutes. This is in addition to filling a BAU data form to track travelers. For those passengers coming from China, Iran and other countries with suspected cases of coronavirus, the screening is more intensive.
We are coming from US and they didn't take this precaution. I'm impressed. I'm not bothered. I can waste as much time as possible here.
I think the measures are okay. We filled up the form and we were screened. There were no exemptions.
All agencies at the airport are more vigilant and adhering to health care measures.
The airline to have it as a duty to screen their passengers on their own, and of course adopting the same mechanism of having the health history of individual, and of course having a carry-on machine to check their body status.
As the governor of Lagos State also inspected isolation ward and biosecurity laboratory at the infection disease hospital.
I've invited some of my fellow governors and some commissioners of health around Lagos, especially around the southwest, just so that we can explain to them where we are, what we've been doing, but more importantly, to see how we can scale up right around the Federation centers like this.
The Lagos State government promised to use sensitization as a veritable tool for arresting the spread of coronavirus. In Lagos, Michael Olaleye, NT News.
From Lagos, we move over to Kano. The Kano State Ministry of Health has put in place measures to prevent the infiltration of COVID-19 into the state. This was disclosed at a meeting attended by people of vested interests. Hadiza Muhammad reports.
The densely populated area, commercial nerve center and home of the first West African International Airport, it becomes necessary for the state government to take stringent measures to prevent importation of COVID-19 into the country. It was against this background that the state government reactivated the rapid response team to ensure surveillance and create awareness among people on symptoms and precautionary measures against the deadly disease.
Identified and been trained and have been posted to that center to manage appropriately any case that is brought or that is referred to that center. And we have repositioned drugs and personal protective equipment in the center.
Kano State government has also deployed personnel to the Aminu Kano International Airport to ensure proper screening of air travelers. The meeting advised citizens not to panic or spread unverified rumor and report any suspected case to the nearest healthcare facility. It was attended by the representatives of the state government, Nigeria Center for Disease Control, and other relevant stakeholders. From Kano, Hadiza Muhammad, NTA News.
And to the Plateau, now Governor of a state, Simon Bakola Long, says there is no case of coronavirus in Plateau State as being rumored and circulated in the social media and some outlets, and as such, there should not be any cause for panic. The governor was speaking at a vigil mass for late Senator Ignatius Longjan of the St. Louis Catholic Church, Jos. Governor Lalong explained that the investigation of the 3 Chinese miners who arrived was a local government area from China and were screened both in Ethiopia and in Abuja and cleared. He said the investigation by health officials in Plateau State was a precautionary measure to further assurances.
We are doing our best to correct it now, so that people will feel free. So please be comforted, be free. We are ready. Commissioner is here, he knows what we have done. I said, Ebola wanted to come here, we stopped it. Coronavirus cannot enter Plateau State.
Meanwhile, the Bioresources Institute of Nigeria, an independent bioscience research and development organization, has come up with claims that it has an experimental lead compound that was identified and patented 5 years ago as a possible treatment for the emerging novel coronavirus, now codenamed COVID-19. The institute, which is soliciting support from Nigerian government to complete the development of the drug, said it is willing to make available the lead compounds and the phytomedicine, which contain the active molecule, for possible evaluation by other laboratories with appropriate testing facility both in Nigeria and overseas. It will be recalled that when Ebola virus infection broke out in 2014, the research group had an experimental lead compound that was identified 15 years earlier in 1999. And now, the group, led by Professor Maurice Iwu, said it has concluded arrangements with the antiviral program of the U.S. National Institute of Health to subject the compound to biopsy against the Wuhan coronavirus, also known as COVID-19.
The program will be able to go on. We also considering, instead of actually developing one of the products, to develop the 3 of them together and have them to be the first broad-spectrum antiviral agent coming out from Nigeria.
Both the Federal Ministries of Science and Technology as well as Health have expressed readiness to give full support to ensure the project succeeds.
We already have a committee of the best minds in this area, toxicology, pharmacy, pharmacognosy, all the 5 drug-related areas of study. So I'm happy that this compound will also be made available, since it's already patented, made available to them, so that for them to certify. Because for us, this is at the research stage, and once we prove that, yes, they will advise us. If they advise us that, yes, this is the way to find this treatment, this is the way to find a better way of managing any of these diseases, we'll be very happy to give all that support.
Depends on who is handling what and at what point in time. But I think the most important thing is to say that we're very impressed with what we have done so far, and the least we can do is to support you and collaborate with you so that we'll take it to the promised land. Thank you.
Coronavirus and other zoonotic diseases like Ebola and Lassa plaguing countries of the world are now beginning more than ever to question the acceptability of the way human beings relate with animals.
With the theme Sustaining All Life on Health, World Wildlife Day 2020 is celebrating the intrinsic and incalculable value of wildlife by promoting ecological balance and addressing the innate dangers of man's unhealthy relationship with wild fauna and flora. Onengie Fineface has more on the imports of the day celebrated on 3rd March every year.
7-year-old Mahfouz Akande had just enjoyed a beautiful encounter with some animals at the National Park Service in Abuja. I took the liberty of his encounter to discuss the impact of unhealthy environmental practices that are threatening the existence of the animals in the park.
Are you aware that some aunties and uncles, mommies and daddies, kill these animals as food?
Yes.
Do you like it like that when they kill these animals?
No.
Why?
Because they are allowed to live freely like us. For example, if they are killing us, how will we feel?
Rather emotional, the response of Mahfouz. And it does justify global concerns over human activities that negatively affect plants and animals living in the wild. World Wildlife Day is set aside by the United Nations to fight human-induced crimes against the ecosystem, which results in the reduction, threat, and extinction of wildlife.
Ecosystem destruction is more dangerous than hunting of animals. The maximum you can hunt at a time may not be more than 1, 2. But when you destroy an ecosystem, you are destroying a whole family of animals.
The theme for World Wildlife Day 2020, Sustaining All Life on Earth, is chosen in consonance with the Sustainable Development Goals of eradicating poverty, promoting better consumption and production patterns, as well as conserving lives below water and on land.
Today we have problem of flooding, we have problem of erosion, we have problem of climate change associated problems. We know all this, and these are as results of negative activities of humans on the environment and on the climate.
2020 is designated Biodiversity Super Year, a time for man to reconsider his relationship with the wild, learn from the zoonotic diseases ravaging the world. Above all, come to the understanding that all life on earth matter. And as Mahfouz Akande would ask,
for example, if they are killing us, how will we feel?
In Abuja, Onengie Fineface, NTA News.
You are watching the news at 10 on NTA News 24, reaching you live on the network service of the NTA. When we return,
our correspondent will share with us the mood of the stadium as a youth regale in culture and sports. Stay with us.
COVID-19 transmission is mostly through droplets from sneezing and saliva. The most effective way to protect yourself from the virus is to practice good personal hygiene. Wash hands with soap under running water or use an alcohol-based sanitizer if water is not available. Maintain at least 2 meters distance between yourself and anyone who is coughing or sneezing. Cover your mouth and nose with your elbow or tissue when you cough or sneeze. Dispose of the used tissue immediately. If you have traveled recently to a country with COVID-19 outbreak in the last 14 days and you have a fever, cough, or breathing difficulty, call NCDC toll-free numbers before going to the hospital. This message is from the National Orientation Agency.
Yes. Oh. Now my dirty they smell like this. Now to throw away am quick. This kind smell fit make man sick. That woman throway dirty for ground. Me sef go do the same this time around.
Hold up.
See, to do this kind badness by the book, you make sure say person no dey look. And then you drop am nicely. Bros, nothing will happen. Trust me.
See, if you throw away dirty for ground, another person sef throw away dirty. Everybody come begin to throw away dirty for ground. Everywhere go come dey smell. Gutter go block, road go block, and you wey like to dey dab. Na him say no more dabbing for you be that o. Dab 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 dab. Yes.
Jerry Buhari is a painter and he bagged a degree in 1981. Born on the 11th of July in 1959 at